metabolic disease is one of those root causes of all disease processes. We live in one of the most toxic environments ever in human history.
We have around 55 million people worldwide that have Alzheimer's disease. That number is going to triple by the year 2050.
Most people will die from a heart attack. It's really easy to figure out if you have cardiovascular disease or not.
This episode is sponsored by Momentous Supplements. You may assume that you're getting everything your body needs from your diet or a simple green juice, but I recently discovered that most people, including myself, are still short on essential nutrients our body needs to function at our best. So I have been taking Momentous Creatine, omega-3 and protein daily to ensure that all of my bases are covered. If you follow me on Instagram, you know that I am a huge proponent of 5 grams a day of creatine and 2 grams of EPA and 2 grams of DHA daily. And according to my body weight, I am doing 110 grams of protein per day. Now, supplements can feel like a dirty word, and navigating the space can be daunting due to the lack of trust and transparency. But I've come to learn that I can trust Momentous. This is why I'm actually an advisor to the company. And Momentous makes the decision so much easier for me because my trust in the products are very, very high due to their dedication to working with the best, from their collaboration with experts to their unparalleled commitment to only using the highest quality ingredients possible. And also they have invested heavily in their third-party testing. So there's a reason why the world's best athletes and experts use and help develop Momentous products. So if you're like me and you want to take supplements that are made by and used by the best in the world, go to livemomentous.com and use code NEURO to get 32% off your first subscription order. If you don't feel like subscribing, you can still use my code to get 20% off all of my favorite products. That is livemomentous.com with code NEURO. Hi, Darshan, how are you?
I'm doing so good. Thank you so much for having me.
No, thank you for being here. I really want to start with this one quote that you've said multiple times. The Western medical system is for the 5% of people that are sick. My question is, what is happening to the other 95% of the population who are either struggling with suboptimal health or just wanting to prevent the onset of these diseases?
Yeah. That's the biggest problem that's been a huge gap in medical care over the last 50, 60 years is when you go to a doctor, they're basically there to diagnose an illness and figure out what the pill or the surgery is to treat that illness, right? But before you get to an illness, we have this 20 to 30 year span of time in our biology that things are slowly getting worse, right? And we don't know it, and we don't really have a place to go evaluate us and tell us what to do during that time that your ship is kind of headed in the wrong direction, right?
Yeah.
And so that's kind of the focus of my last 8 years in medicine is how do we create the environment and the place where you can focus on optimizing your health so you never get sick in the first place, right? Mm. And I think a lot of people are talking about this, which is fantastic. I'm so excited about kind of the rise of functional medicine and integrative medicine and all the things that are happening through things like podcasting and what you're doing. But also I think people need a place to go. People need a place to kind of bring it all together for them.
Yeah.
And so that's been the focus of my last few years.
It's interesting you said that. The last 5 years, we've seen a massive boom in the longevity and health span space, which is great. But I still think for the 95% of the population who don't really understand what that means are still sitting on the sidelines without having any idea on how to improve their health, and they are still relying on Western medicine physicians. And by the way, I'm very much for Western medicine. I just think it should be shifted to a maybe a 2.0 or 3. We need to reimagine what it means, what medicine means.
Exactly. Really, people need to have a shift in their mindset about what Western medicine really means, right? So Western medicine is there for when you get really, really sick or you have a traumatic injury or, God forbid, you develop cancer and you need specific treatment for that. It is not a place to go to seek health, right? And so what happens is when you try to seek health and you wait for Western medicine to finally get to you, it's too late. It's not completely too late. We can still turn it around, but now we're working on turning things around when you should have never got there in the first place. And we have many examples of this. Metabolic disease is the perfect example. people are developing metabolic disease for 20 to 30 years before they get a diagnosis of diabetes, right?
Okay.
But that entire time, they should have been doing something else for it.
So would you say, actually let's focus in on metabolic health and metabolic disease. And so we know now that the top 3 killers in the world is cardiovascular disease. That's global, right? That's not just US based.
It's all over the world, every country, and it's even in countries that are not Western countries is now on the rise as well.
It's very scary. Then we've got cancer, and then we've got Alzheimer's disease. Right. Now, they all have some form of relationship with one another, and that could be metabolic health. So let's discuss what metabolic health is and how to prevent metabolic dysfunction so we don't get type 2 diabetes, which can then lead into cardiovascular disease and also Alzheimer's disease.
Or type 3 diabetes.
Or type 3 diabetes,
which is Alzheimer's disease. Right,
yeah.
Exactly. Yeah, absolutely. It's my favorite topic to talk about because really when you look at all of these diseases, we've convinced people that we need to silo them by organ, heart disease, brain disease, right?
And how many specialties do we have?
There's like 45 specialties in medicine. It's crazy, right? And we've convinced people that that's the way the body works, is that each organ has its independent function, is kind of siloed off into doing its thing. But nothing could be further from the truth. There are root causes that lead to all of these diseases that make them interconnected. Yes, when that organ starts to fail, you start seeing symptoms of that organ failing, and then you apply a medicine to cover up those symptoms. But if you really get back to the root causes, they're all come from the same place, right? And so metabolic disease is one of those root causes of all disease processes. So from there, people should know and understand that if you were to prevent and to treat metabolic syndrome or metabolic disease, you will avoid cardiac disease, Alzheimer's, and cancer, pretty much autoimmune disease, all the diseases, right?
Thank you to Maui Nui Venison for sponsoring today's episode. Have you been stuck in traffic or out for a while, gotten hungry, and wished you had a high-protein snack that is nutrient-dense, easy to carry around, and preservative-free? Maui Nui is the answer. Team, I have been munching on these Maui Nui venison sticks for around 3 months now, and it's changed my life. Maui Nui is the only stress-free, 100% wild harvested meat on the market. In fact, researchers at Utah State have shown that this meat is the most nutrient-dense red meat available on the market. If you guys follow me on Instagram, you know that I have been taking at least 2 sticks with me every time I leave the house. That is because each jerky stick contains up to 10 grams of protein in only 55 calories. It has up to 53% more than grass-fed beef than any other jerky, and it tastes amazing. I always take 2 because I know that I'm going to get guaranteed 20 grams of protein when I'm out and I'm on the go and I don't want to eat any fast food. I don't want to pick anything up. I don't want to spend any money. I just want to eat my nutrient-dense jerky sticks. I highly recommend trying all of their natural venison jerky sticks just so you can see which one you like. They are an optimal protein snack, but for those of you who are like, I don't want jerky venison sticks, they also have a variety of fresh cut meats available on their online butcher shop. I opted for their membership, so I get a supply every month without a hassle. So if you want to try these, you can get 20% off using my code, which is NEURO. So that is mauinuivenison.com/neuro. Especially for you guys who live in LA and you're stuck on the road. Honestly, when you are stuck on that I-10, these will be your best friend. So once again, that is 20% off your first order at mauinuivenison.com/neuro. In terms of autoimmune disease, we still don't know why women are more affected by autoimmune diseases, right? We still don't have an answer to that. For example, MS. The majority of the MS diagnoses happen in females.
Right.
Yeah.
Yeah, we don't know yet. There's a lot of suspicion and theories out there. Maybe it's due to the rapid decline of estrogen after menopause. It could be due to that. There could be other factors involved, but definitely women do suffer from this at a much higher rate than men do. But whether or not, like I had an autoimmune disease, whether or not you're a male or a female, an autoimmune disease is a terrible black box for most people, and they just don't know what to do about it, right? And so the immediate reaction of the Western medical system is to put you on some sort of immunosuppressive or biologic.
Like a steroid.
Yes, that has a ton of side effects. And all you're doing is covering up the symptoms of the autoimmune disease, dampening the autoimmune disease, but you're dampening the entire immune system. And the problem with that is now you're more susceptible to having a poor immune system. What does that make you more susceptible to? Infections, cancer, heart disease, all of the other diseases. So you're just chasing your tail a lot. And so once again, if you focus in on the root cause of disease, of which metabolic syndrome is one of them, another one is inflammation. So inflammation is another cause of why people are getting autoimmune disease at an incredibly accelerated rate now. I mean, it's mind-blowing. I mean, I think I see 1 in 5 or 1 or 6 patients that have some level of autoimmunity developing in their biomarkers. You really, once you focus in on those root causes, you will see, once again, a dampening of all of these disease processes.
Okay, so we've got metabolic syndrome. I probably cut you off, but I know that there are specific biomarkers that can actually diagnose you with metabolic dysfunction. But what exactly is metabolic dysfunction?
Yeah, it's a great question. So metabolic dysfunction at its kind of root biological level is the inability at the cellular level to utilize energy properly. And what happens is because of an overabundance of energy being delivered to our body in the form of glucose, fructose, and carbohydrate sugars that is more than the body needs, we have an organ in our body that kind of forces that glucose out of our blood by secreting insulin. That organ is a pancreas, right? And so when you have too much insulin in your bloodstream and too much glucose in your bloodstream, stuffing this glucose into a cell, your cell doesn't need all of that. And so what it does is it starts to get insulin resistant. The cell says, too much energy being pumped into me, I'm going to become resistant to insulin, so we stop taking in all of this glucose. That insulin resistance builds up over time and causes tons of damage to us at a cellular level and also at an organ level.
Okay, so we've got, and that's obviously, so metabolic dysfunction, we have an inability to produce energy. That's via the mitochondria. Yeah, so mitochondria ends up becoming dysfunctional. Maybe they die off or maybe they just stick there and they become like non-functional factories, if you will. So when we have that, then we can't produce energy, and without energy, we pretty much
can't do anything.
Right. Okay. So and we need energy to fight off certain diseases, all right? So that's the first one. You mentioned the word inflammation. This also is deemed as this scary molecule, right? We need inflammation, okay? But it's like that Goldilocks molecule, right? Too much of it, chronic inflammation is bad. Not enough of it is bad. So we need it at the right times. Like, for example, if we are going to exercise, we need to have certain amount of inflammation to repair and build the muscle fibers. But too much of it, chronic inflammation is the wrong thing. So what is inflammation? And I guess, how can you assess inflammation through different types of biomarkers in blood work?
Yes, and I want to address the biomarkers of metabolic syndrome too, because you asked me of that. But let's just go over inflammation quickly and give an explanation to the public about what this means. So like you said, inflammation is a process in our body that we've developed over centuries and generations in evolution to help us heal from injury. So exercise is a muscle injury, helps us heal from that injury. It helps fight off infections as well. So any foreign invader in our body, inflammation is a process that fights off infection. It heals injuries. But the problem is at a cellular level, when cells are crying for help, it activates this inflammatory system because the cells are dying. The inflammatory system is made to help the cells either get better or to remove the cells from our system, right? And when all of our cells are crying for help, inflammation is running rampant. It is going on constantly at a very high level. And what you're doing when you have inflammation at a high level going on in your body, all the time. It's kind of like a slow burning on the inside of your body, destroying good cells, normal cells, cells in your liver, in your brain, in your heart, everywhere. And so we have this base level of inflammation constantly trying to heal us from the inside, but it's actually causing more damage than good. So metabolic syndrome and inflammation go hand in hand.
Yeah.
They occur together, as well as oxidative stress. All of these three things are all occurring together because of our huge exposure nowadays to toxins in the world. We live in one of the most toxic environments ever in human history. Toxins in our air, our water, and our food because of our diets, so our foods and ultra-processed foods and the chemicals we put in our gut, destroying our gut lining and our microbiome. And thirdly, because of the water that we're drinking and microplastics in our water as well are causing a lot of inflammation. And lastly, inactivity as well. Our sedentary lifestyles cause a lot of inflammation as well. So all these lifestyle factors lead to mitochondrial dysfunction, inflammation, oxidative stress, metabolic syndrome, and then that leads to diseases.
Wow.
Yeah.
It seems like a cascade event.
It's a cascade.
Really.
Exactly.
And then what are some of the biomarkers for metabolic syndrome?
Okay, so some of my favorite biomarkers, which every person out there should be able to ask their doctor for these biomarkers, and they should order them. And if they do not order them, I always say you need to find a new doctor that will work with you on this. And these should be checked at least every 6 months, if not quarterly, right? So for metabolic dysfunction, I would like to look at insulin levels. I like to look at hemoglobin A1C and triglyceride levels. I think those are three very important biomarkers I like to look at to start with. And then there's other biomarkers you can do that can kind of take it to the next level. But those three give you a really good idea. Hemoglobin A1C is a 3-month average of your overall glucose. Insulin is the first hormone, we talked about insulin, that goes up when your glucose levels are high. And so you want to get a fasting insulin level. What is your insulin when you haven't been eating for 8 hours? And triglycerides are also another measure of metabolic disease.
Interesting. Have you heard of the HOMA-IR?
Yes. Mm-hmm.
Yeah. Could we just talk about that? Because I know it's a wonderful mathematical equation, if you will, that can actually pick up on if you are insulin resistant.
Exactly. Go ahead.
I was going to say, I don't think many physicians, if people are out there just going and seeing their regular PCP, they're not actually giving you a fasting insulin test. You actually have to beg for one. Is that correct?
I think what happens is people have their doctor appointment whenever the doctor can fit them in.
Correct.
And sometimes it's 3 o'clock in the afternoon. No one even tells them they need to be fasting, and it's not practical to fast until that late in the day anyway. And so a lot of times doctors just say, let's just get whatever blood work we can and we'll just deal with the values when we see them. And anything that you need to do fasting, like such as, insulin levels or fasting glucose or even fasting lipid levels, get kind of put by the wayside and not really looked at, which is very unfortunate. It's kind of like blood pressure. Like when you go to the doctor's office, that's the worst blood pressure you can take, which is, you're stressed. The staff member doing it is stressed. Everyone's in a rush. Blood pressure is the same thing. Like you need to make sure you're checking this at the right time of day under the right conditions. So if your doctor is not ordering fasting levels on you, you should insist on it. Insist on a morning appointment or just insist on coming in for your blood work first thing in the morning and then you do your visit later in the day.
Yeah, when it comes to the hemoglobin A1C, you said it's a measure of the amount of glucose in a red blood cell over the last 3 months. Can people opt for doing a pinprick test every morning to check their fasting glucose as well?
That is definitely one way to do it, is to buy one of those pinprick machines and check your fasting glucose. A much better way to do it is to get a continuous glucose monitor.
Yeah.
Yeah. And I would say, the investment between a CGM and a glucose home pinprick machine, it's almost the same if you really look at all the, the little sticks you need to buy and all that. So I would just go with a CGM, use a company like Levels or Ultrahuman. These are companies that provide these for you for I think it's $200 a month. And you don't have to wear it forever, but if you don't want to, but at least 2 or 3 months, really understand what your glucose is doing after eating certain foods, after not getting a good night's sleep. It's a game changer for people. Not only will it completely kind of change your relationship with food, but you'll learn so much about your body and how your body functions under times of stress and sleep, etc.
Yeah, I love it because it gives you a really accurate measurement of the day before, what didn't work well, what did. And then I was actually wearing the CGM from glucose for quite some time. And, it was like, if I ate a grape, I would see my glucose spike up, and you become more intelligent. And I think that's what I'm trying to teach everybody through this podcast and through the various things that I put out there. I want people to become more intelligent on their own health. And one of those things is understanding biomarkers, which we just went through. But I'd love to get your take on the numbers and the readings, because even, you look at the standard guidelines from the American Heart Association, they'll say an LDL, which we haven't gone over yet, guys, but we will. An LDL, something found on a lipid panel, anything below 100 is recommended, whereas I think that anything below 90 or even 80 is much better. So when it comes to hemoglobin A1C as a percentage, what do you think the best score would be?
I love what you're talking about just in general around biomarkers, because it's so valuable for people to understand that these are not just static numbers in time. With biomarkers, you want to know what is abnormal, which is the disease state. What is optimal? Like, where do you want to aim to be, right? And then you want to be following the directionality of these biomarkers.
Yeah.
So it's like the rate of change in the wrong direction tells you a lot as well. So hemoglobin A1C is a perfect example to illustrate all of this. Hemoglobin A1C, your doctor's not going to tell you there's a problem until you're over 6.5 or 7.
Which is pre-diabetic, right?
Yes, exactly. Yes. Yep. So now you're like pre-diabetic, diabetic range. But it took you 20 years to get to this place of your lifestyle habits. So really the optimal hemoglobin A1C, in my view, what I aim for is 5.2 or less, okay? And so there's a long time that it goes from 5.2 to 5.3 to 5.5 to 5.7, and then, into the diabetes range. That is usually a period of like 10, 20 years. If you know it's going the wrong direction, you're going to change your habits, right? You're going to maybe work in some activity during the day. You might get a continuous glucose monitor. Look at what kind of foods you're eating that cause glucose spikes. Things like grapes you mentioned can do that for people. And I think you learn so much when it's the right time rather than waiting for too long. So it's about directionality and optimal levels with each biomarker. Not every biomarker has an optimal level, and you want to follow the direction of it.
So, okay, so we've got the hemoglobin A1C, we want it below 5.2%. And then I also want to go through some biomarkers for inflammation.
Sure.
We've got the regular one, which is C-reactive protein or HSCRP, and you want that at...
You want it as close to 0 as possible, but definitely less than 1.
Less than 1 is great. How about cortisol?
Cortisol is a tough one because cortisol needs to be measured throughout the day because your cortisol rises and falls throughout the day. And also cortisol can sometimes can kind of misguide you if you're just checking it just one time, depending on what's happened in the last 24 hours, right?
Yes.
And so you really need to do this test multiple times over a 24-hour period. And there are spit tests that you can do 4 times a day. You can do a 24-hour urine cortisol. I don't find a lot of value in cortisol as an initial measure of how your adrenal gland is functioning. And a lot of people try to equate it to overall stress, and it does go up with stress. But I do think that it's one of those biomarkers that you really need to dive in with a functional physician or an integrative medicine physician to really understand what it means and how to affect it.
Yeah, I had my bloods taken, and she came. So it was fasting, and I had a phlebotomist actually come to my place and do it. And she thinks she came at like 10 a.m. So I was fasted evidently, but I did an ice bath, and my cortisol came up as like 25. And I was looking at it, I was like, oh my gosh, but you're right, it does fluctuate throughout the day. And we know that when you jump into a cold bath, of course, cortisol is going to rise. Yes. So that's really interesting. Okay. And then let's keep moving downstream from this. Let's say, okay, great. We've looked at root causes. We understand how we can kind of get a measurement of that. But now we want to understand what is our risk of cardiovascular disease. And let's talk about what that is, and then we can move into a lipid panel after that.
Yeah, for sure. I love talking about cardiovascular disease because number one, most people will die from a heart attack, right? So, and it's so...
That's so nice to hear.
I know, it's terrible, right? And so, 50% of people don't know they have cardiac disease until their first heart attack. And 50% of those people will die from their first heart attack. So it's really sad because we have the technology and we've had it for decades to prevent this from happening, right? So big picture, when we talk about heart diseases, there's a lot of things that can go wrong with your heart. Your heart has an electrical system, so you can get arrhythmias. Your heart has blood vessels that are supplying it, so you can get blockages in those blood vessels, which causes a heart attack. Your heart has valves that can misfire or misfunction, which can cause valvular disease. But if you really want to kind of hone in on the one thing that will make the largest difference for the most amount of people is understanding plaque formation and blood vessel disease in the heart. Okay.
I find this is going to be such a controversial topic because even me, it's very confusing on social media when you see somebody who is plant-based only talking about plaque formation and cardiovascular disease as opposed to someone who's on the carnivore diet speaking about atherosclerosis and cardiovascular disease. So I think there's so much misinformation here.
Yeah, there absolutely is. And it's because people are getting religious about their cholesterol levels. And the one thing is going to clear it up for you is to understand plaque formation and blockages in blood vessels. You have to understand it's a combination of three different things. High cholesterol doesn't necessarily lead to plaque formation without the other two things. The other two things are damage to the interior of the blood vessel wall. So the endothelium is the inside of the blood vessel. That layer is a cell layer thick, and that can get damaged with high blood pressure, for example, overtraining. You want to protect that layer of the blood vessel, and there's different ways we can talk about doing that. And thirdly is inflammation. So it's a combination of inflammation, damage to the endothelium, and high cholesterol, the three of those things together. So if you're managing your inflammation, if you don't have high blood pressure, you're not overtraining, just because your LDL is a little bit high doesn't necessarily mean that that's going to lead to you having cardiovascular disease. Now, all of that being said, it's really easy to figure out if you have cardiovascular disease or not. There's a quick scan that you can get of your heart. It's called a coronary calcium score. It's a CAT scan of your heart. I recommend it to all of my patients that are over the age of 40 to at least get a baseline one so you know where you're at. This checks for hard plaque, so calcification inside your blood vessel, which is an indicator of advanced plaque formation in your vessels. So have you had one of these done yet?
I have. I got a 0.
Awesome. Good. I'm a 0 as well. And I could tell you that we've saved so many lives by getting this test at a young age.
What have you seen? Have you seen anything above 2?
Oh my gosh. I mean, we've seen scores in the hundreds and even in the thousands with calcium scores. Yeah.
Okay.
Yeah. The scores can go up to 1,000 or more. And I'll give you a perfect story. So my brother was going to climb Kilimanjaro, and he went and got this scan done at my insistence because he was like, going to do this really physical activity. He's 43 years old, and he's a vegetarian as well. And no indication of why he should have any heart disease. Got the calcium score, found he had a major blood vessel blockage, and had to have that treated before he canceled the hike, of course. But, I see this over and over again. People going straight from getting the calcium score to the hospital because they have a major blood vessel blockage they had no idea that they had. A lot of the people getting heart attacks at a young age is from undetected coronary blockages, right?
Yeah. So, and also, when we'll go through a lipid panel as well, but I know that one of the risk factors of as well as that is having a high Lp(a) score.
Exactly.
So, all right, so we've got cholesterol, and a lot of people still don't understand when they look at a blood panel and you look at the lipids and it's the measure of the fats in your blood. We've got triglycerides, total cholesterol, you've got LDL, HDL. Then we've got something else, which I'm so happy that a lot of people are getting now, which is called ApoB. So why don't we go through all of that? Because that gives you a really nice picture of your health and the status of your cardiac health. But I always like to look at two things. It's trends, which you've pointed out, and ratios. I know there's a really great ratio between LDL and HDL, and we can go through that when we get there as well.
Yeah, and triglycerides and HDL as well.
Yeah, yes.
Yeah. So let's talk about just, I think in general, I'm a big fan of people becoming the CEO of their own health, right? A CEO looks at their numbers at a frequent basis to understand where those numbers are headed, and they understand what each one of those numbers means. So you have a profit and loss statement, you understand like gross profit, loss, you understand those numbers. Everyone needs to do that for about 10 or 12 different biomarkers. And some of them are in the lipid panel. Mm-hmm. I love ApoB because ApoB is a collective biomarker of all the bad forms of cholesterol. And I'm using, quotations for bad because I don't really like that word, but it tells you how much LDL you have, how much VLDL you have, and how much Lp(a) you have. Lp(a) is a genetic form of cholesterol that's present in almost 15 to 20% of people that is severely damaging and not very modifiable by lifestyle changes. And so if you have
medication.
Or medication, right? So Lp(a) was going undetected for years when we just had the standard lipid panel. But now that we have ApoB, we can detect this, right? Mm-hmm. So if your ApoB is high and your LDL is okay, get your Lp(a) checked. In fact, everyone should have their Lp(a) checked because so many people have it. So ApoB is one of my favorite biomarkers there. Once you know where your ApoB is at, you can kind of dissect down into LDL, VLDL, and HDL. HDL is a protective form of cholesterol. So if your HDL is high, that's a good thing. However, I will say that driving HDL high with pharmaceuticals has not been shown to be helpful. So, pharmaceutical companies did not win that one.
Yeah. And in fact, you can actually see in the clinical literature that it says that anything above 80 increases your risk of cancer for HDL.
For HDL.
Yeah.
Wow. Yeah, I did not know that, but I'd love to talk more to you with you about that. So anyhow, I would focus in on ApoB as one of the biomarkers that people follow. And I agree with you. You want to kind of keep that under control as much as possible. So we like to see it about 100 or less if possible for our patients, especially in the face of risk factors for cardiac disease. So hypertension, family history, et cetera.
Yeah, it's when I look at the relationship between LDL and HDL, I always say that we want it at a 2 to 1. Mm-hmm. And I describe it as, HDL are the janitors and LDL is like the little cookie crumbs that are left over at the end of the night, right? The HDL, they come in and they just sweep up the cookie crumbs and they sweep it out. And it's great, right? It's like one janitor per 2 molecules or per 2 cookie crumbs, right? Yeah. But what happens is if you actually, in some instances, you've probably seen this where people come back with a higher HDL than LDL, and that's dyslipidemia. And so, but people will be like, but Louisa, my LDL's fine. It's like, that's not what it's about. Yeah. So I always say that anyone can take your blood. It takes, 2 days to become a registered phlebotomist, I think. It's about who is interpreting your blood results. Right.
And telling you where you're at risk, right?
Yeah.
And then once you know you're at risk, the solution is not always medication. I think people make that jump. Like they don't want to know what their lipid panel is because they think they're going to get put on a statin. Mm. And there's so many different lifestyle interventions you could take in between those 2 points, right? Yeah. And so once people get less scared of the data and you get less fear of the data by understanding that you have effect over all of these. The effect does not necessarily need to be a pharmaceutical agent, and you can learn about these and what they mean. It's not that difficult. I think then people will change their mind around becoming the CEO of their own health and taking hold of this data and demanding it, right?
Yeah, and I'm not that one who's completely opposed statins, to be honest. No. In the if it's obviously indicated, and I see a lot of people being really scared of statins, maybe the side effects, which are pretty minimal when it comes to muscle soreness and weakness. I think that's only a small % of the population that experience that.
Statins have become a religious debate now for whatever reason.
There's different types, right? You've got PCSK9 inhibitors and they all serve different purposes.
Yes, yeah. So there's different ways to lower your cholesterol. Yes. One is a statin.
A statin, yes.
One is a PCSK9 inhibitor, which does it in a different fashion by affecting your liver enzymes. And another one is ezetimibe, Zetia, which decreases absorption of cholesterol from your gut. There's more classes of these medications coming out in the future. I think the problem with statins occurred when they became one of the most overprescribed medications in human history. They were overmarketed, and it became like a gut reaction or a quick reaction for a primary care doctor once they saw a high LDL to immediately put someone on a statin with little thought to the overall process of why someone is getting put on the statin in the first place. So sadly, it's become a hotly contentious topic. Statins have been shown to decrease inflammation. Statins have been shown to, of course, reduce lipid levels. I think you have to just work with a practitioner that really understands how to work up your lipid levels, why they are high, to be able to test things like sterols so you can see where you're having a problem with dyslipidemia. Is it in the absorption of it versus the production? And then once you know that, you can direct therapy. Right?
Correct. And I got asked this question the other day on social media. Louisa, what's the best way? If you could think of anything, what is the best way to lower your LDL in like the matter of 3 months? And unfortunately, we don't see a direct association between exercise and cholesterol, which is so unfortunate, right? But then we have to turn then to nutrition interventions. And I don't know what your take is, and I hate that I'm going to say this, but if I had to do it, like, let's just say we had to lower LDL in 6 weeks, it would predominantly be plant-based diet, or 90% plant-based.
I would say you're correct in that. The most researched diets around there for lowering LDL are, extremely well researched. There's some form of plant-based diet or Mediterranean diet have been proven to lower LDL. That being said, the best way to lower LDL quickly, if it's urgent, is going to be a statin.
Yes, obviously,
or a PCSK9 inhibitor. And my counseling to patients is, I understand you might be scared of this. It doesn't need to be forever. It can be a temporary thing while we get your lifestyle in order. To be honest, it takes at least a year to get your lifestyle in order for even the most motivated people. So why not protect your vessels in the meanwhile, right?
Yeah, and I always say that good physicians are able to treat the disease of the patient, but phenomenal physicians are able to treat the patient's behaviors, because we know that adherence to protocols is what's going to move the needle forward. And in order to, what I've seen and observed is, in order to move the needle forward through interventions and adherence, you have to understand the person's behaviors. Do you get up in the morning and are you motivated to get going? Do you go to sleep at night? So you have to understand what motivates them, what are their behaviors, so they can stick to the interventions and then see the needle being moved.
You're so right about that. And, I think for you and I in practice, I actually see patients all the time. You see so many different people with different biology, different motivations, different mindsets around, and different lives. Their lifestyles are so different as far as how busy they are and their stress levels. And I spend all of my time trying to dissect all of that with patients and trying to figure out what's going to work the best for that particular individual, right?
Yes.
And when you get on social media, it's so binary or polarized. You have to be on the carnivore diet. If you're not, you're an idiot. Or you have to be a vegan. If you're not, you're a bad person. It's so polarized when most people are not on polar opposites of the bell-shaped curve, right? The bell-shaped curve, there's polar opposites. Then you have one standard deviation and 2 standard deviations away from the middle. And my time is just spent meeting someone where they're at with that. So in the example of statins and high LDL, I have people that are just like, just give me the medication, I'll take it. I don't want to change my lifestyle.
Yeah.
And then you have people on the other side that are like, all I will do is lifestyle interventions. I will never take a statin, no matter what you tell me. I don't care if I'll die from this.
Yes, I know. It's so extreme, right?
It's so extreme.
Yeah.
And so really, people have to find out what is their tolerance level. They have to learn, really learn the science through podcasts like yours, not follow the loudest voice on social media, and understand that they are an N of one. Their individual biology will react differently to an intervention compared to other people.
Yeah.
So most studies are built on averages. What is the average person going to do with this intervention? But you might be 1 or 2 standard deviations away from the average, in which case that therapeutic may not work for you at all or cause a problem.
Yeah. Right? And sadly, it takes a very highly trained physicians such as yourself to be able to really understand this because you have so much more to focus on. You spent probably 5 days in nutrition during medical school, so it takes a lot to understand this. But what I love that you're doing, and we're filming this at NextHealth, which is your company, and you've got so many different things down there. One of the things that you've got where people can come in and I guess experience is you've got a hyperbaric oxygen chamber, but you've also got red light therapy and you've also got infrared saunas. Have you seen any data on infrared saunas and getting yourself to a high level? I don't know what the temperature is down there, but usually I get into an infrared sauna about 180 degrees Fahrenheit. You're getting this massive profusion of blood, and I know that that's doing something to help with the blood vessels, right? It's got to.
Yes, absolutely. So the best studies for sauna therapy or just heat therapy in general come out of Finland, where this is worked into their routine, their daily, weekly routines. They're doing this a lot, and they definitely have a much lower risk of neurodegenerative disease and cardiovascular disease, okay? And so there's a huge association factor between sauna use and preventing cardiovascular disease. There's a lot of theories about why that is. One is heat shock proteins. These are proteins that can that get stimulated with exposure to heat, and they can help reduce inflammation. Another one is potentially nitric oxide release, which helps your blood vessels not be so tight, okay, which cause high blood pressure. There's a huge association between sauna use and lowering of blood pressure as well. You're sweating a lot, right? So you're detoxifying by sweating as well. So there's a lot of potential mechanisms. It's also kind of meditative to be in a sauna as well, right? And so there's a huge benefit just psychologically from that as well. So I think we don't really know how exactly it works. Truthfully, it's going to be multimodal. There's a lot of different reasons it potentially works. But the reason we have it at NextHealth is because we encourage our patients to come in on a frequent basis, weekly, and do some of these therapeutics that they might not have available at their home. It's hard to have a sauna at your house, a cryotherapy, or cold plunge at your house. And just have this like hour or two of self-care on a weekly basis. It's a game changer.
It is a game changer.
And so I think a lot of people really try to focus in on the science of why does a cold plunge work or not work? Why does it? If you just do it, having that routine in your life where you're spending an hour or two on self-care is going to be a game changer for you psychologically and kind of put your ship in the right direction 1 degree more, right? Headed more towards health rather than going out to get a drink and now you're, at the bar drinking 3 or 4 drinks of alcohol. We have a lot of people that come and just meet up here to have IV cocktails instead of, going to the bar for cocktails. And I think just that kind of renewed focus on taking agency over your health, making it part of your day-to-day routine, your weekly routine, is a game changer.
I actually did the glutathione IV, and that can actually help with energy production and help with the mitochondria, right?
Absolutely, yeah. The whole purpose of glutathione is to reduce the radicals that are formed, the free radicals that are formed during energy production at a mitochondrial level. And so by reducing the free energy or the free radicals that get produced, you have a tremendous improvement in mitochondrial health as well.
Yeah, that's I felt amazing after that. I think I just need to do that 2 or 3 times a week and I'll be amazing. Let's move on now to my favorite topic, which is neurological health and brain health. As we know, we have around 55 million people worldwide that have Alzheimer's disease. That number is going to triple by the year 2050. We still don't have a cure. We still don't know what's causing it, which is mind-boggling to me that we are, getting to Mars and to the moon and we still don't know what's causing Alzheimer's disease. The therapeutics, the FDA-approved therapeutics, if you will, that are there to help you with Alzheimer's disease are really just getting rid of the symptoms. And we've spoken about heart health, and I say that what's good for the heart is good for the brain. When we look at these things, you mentioned a heart attack. It's pretty much the same as a stroke. It's an embolism. It's a blockage in a vessel, the same as a pulmonary embolism. So we can have these strokes in the brain as well, which can lead to Alzheimer's disease and other neurological problems. But what are you doing for your patients when it comes to looking at brain health for a preventative measure?
Yeah, it's such an important topic because unfortunately with Alzheimer's, like you said, we do not have a therapeutic that's really effective. I mean, I'm not a big believer in using some of these drugs that have been like pushed through the FDA cycle because the side effects are massive too, right? And you, like you said, you're just masking the symptoms. You're not really turning around the causes here. So I'm a big fan of people's work like Dale Bredesen, who wrote The End of Alzheimer's. I truly believe Alzheimer's is multifactorial. Our brain is such an incredible organ and it's so resilient, but the multifactorial assault on our brain, whether it be toxins in our food or air, water, combined with metabolic syndrome, combined with inflammation, combined with a few other factors, all of those factors that are affecting our brain health are really lifestyle-induced factors. And so if you get your lifestyle in order at a young age and continue to keep it in order for a long period of time, you will prevent Alzheimer's, even if you have an ApoE gene malformation, in my opinion.
Yeah.
I really believe there's a couple gene mutations that can, almost certainly lead to neurodegenerative disease, but ApoE is not one of them. It does increase your risk, which means you have to be that much more cognizant and about getting your lifestyle in order.
Yeah.
The other thing I will say about Alzheimer's, that I think we're in a moment right now that is very interesting in that I think people's perspective is changing around Alzheimer's. I think there's been so many failed drugs that I think in my mind, in the scientific research community at least, that the kind of thought process that we're going to find a drug that cures Alzheimer's is kind of fading into the background. Instead, what we're seeing is a renewed focus on early diagnosis and early prevention. And so there are tests that are coming out that can potentially detect Alzheimer's at a much earlier stage that are a blood test, things like the beta-tau protein test that I'm sure you're familiar with, and amyloid tests from your bloodstream.
Yeah.
Yeah, I'm curious to hear your opinion on those because I feel like that could potentially be a game changer. Secondly, I think that we are now looking deeper into modalities such as hyperbaric oxygen therapy for preventative reasons, therapeutic plasma exchange also for preventative and also to slow the rate of cognitive decline with Alzheimer's as well. So I think people are looking at alternative therapies now more, which I think is definitely going to be a game changer. And again, focusing on the root causes, detoxifying your life, keeping metabolic syndrome and metabolic disease at bay, et cetera.
Yeah, look, it's so difficult because you could probably think, I imagine sitting with my grandmother, who's not with us anymore, but I can imagine just talking to her about this. And she grew up in Cyprus where obviously before technology, before microplastics, and she would just think, well, why can't you just eat food from the ground? It's like, well, unfortunately, we don't live in that society anymore. We are constantly at the mercy of these insults coming from lack of sleep, lack of proper nutrition, lack of physical activity, and these microplastics, which I've said it like 3 times today because it's still daunting. That study that we've discussed before of the microplastics that were found in coronary arteries and testicles.
Yeah.
Which is scary for anybody wanting to conceive out there.
Exactly.
It's like, oh, that's scary. So we have to have a measure of prevention, but detoxification as well. I mean, I don't know. It's scary to me. Even thinking that the food that I'm trying to buy is probably still not nutritious.
Mm-hmm. Yeah, it's sad. We live, once again, in one of the most toxic societies ever. The human history is, and Cyprus is actually isn't that one of the blue zones where people tend to live a lot longer? So,
it is.
I would love to visit Cyprus one day because I think these blue zones have definitely figured out something, But however, I will say that, listen, I talk to my patients about detoxifying your life and your environment all the time. It seems super overwhelming, but I love to explain the Pareto principle. What are the 20% of actions you can take to detoxify 80% of your life? And there's a few things there that I think if people were to do, they will live in a much less toxic environment than 95% of the people out there. Of course, like excluding the blue zones because those people are definitely living in an incredible environment. So I tell people, let's focus in on air, water, food, and your skin. Air meaning where do you spend the most time during your day? Usually at work and at home, sleeping in your bed. Those 2 environments, put a good quality air filter in those environments. Make sure that your home has the air filters changed open the windows if you live in a place where the air outside is actually healthy for you versus just exposing yourself to indoor air. Doing that is going to really help you breathe in less toxins that are in our environment, mold, including mold, by the way. Secondly is your water. Try to drink water from a filtered source or a reverse osmosis source as much as possible. The best way to do that is have a glass bottle that you fill up with water at home from a reverse osmosis under your sink or from a filter. If you're drinking that water all day and sticking to mostly water as your hydration source, you got your water kind of fixed.
Okay.
Right? And then finally, your food, trying to eat organic as much as possible. Also, go to the Environmental Working Group's website. They list the Dirty Dozen, EWG.org. The Dirty Dozen are, if you can't buy organic, you definitely want to avoid these 12 foods. And stay away from ultra-processed food. Try to eat, right? And then lastly, your skin. Most of the cosmetics that we put on our skin that we buy off the shelf are laden with forever chemicals and toxins. Instead, try to find ones that are that have less chemicals or no chemicals. The easiest way to do that is to find an app like Think Dirty is a great app to help you find alternative products. And then also the Environmental Working Group has a really good site as well that helps you find clean products. So if you do those few things and avoid smoking and minimize alcohol, you're doing better than 98% of the people out there. And you can really kind of detoxify your life.
Yeah. Oh my gosh, I love that. But I imagine like a lot of women thinking, easy for you to say. I mean, that's what I was thinking. So I want to finish up by, I guess, giving me a crash course on this whole world of gut health. I know you speak about it a lot. I know that this can also be another problem when we're trying to optimize our health, avoid diseases, because our gut lining, you said it, it's like 1 cell thick, and if it becomes permeable, we leach in all these things that we don't want it to. That can go up to the brain. So what is gut health?
Yeah, so unfortunately, gut health has just in the last 5 to 10 years come to the forefront of our thoughts around health in general. Because the gut is kind of like inside of us and you don't really know anything's going on in your gut until things are really, really bad. It's kind of the one that the symptoms really trail as far as what's going on in our gut. It's been a root cause of disease for a century now, and we have not known about it. So my reason for telling you all that is like the science is still so brand new on this. There's so much we have to learn. But what we do know is that our gut, surface area-wise, is our biggest protection from the outside environment. It's like a football field's worth of 1 cell layer thick in our gut, whereas our skin is like, much smaller, about a third of that size. Your gut has 3 layers protecting you from the outside environment. The outside environment being all the toxins we ingest in our food, et cetera. Those 3 layers are our microbiome, which are the thousands or trillions of bacteria, fungi, and viruses that live synergistically inside of us. Second layer is a mucus layer. The mucus is a thin layer that also helps kind of protect us, but also helps glide food through our system. And thirdly is that 1 cell layer thick of enterocytes, which is our own body cells. Now, if all 3 layers break down, toxins just flood into our system, causing inflammation and overactivity of our immune system, which is one of the root causes of disease. So our job then is to keep our gut healthy, right? How do you keep your gut healthy? You support all 3 layers. One way to do this is by eating a lot of fiber. Fiber helps keep food moving through your system. It prevents the absorption of chemicals. It prevents the absorption of toxins. And it also acts as a food for the bacteria.
So like I always say, eat the rainbow.
Exactly.
All right.
Exactly. Fiber comes from vegetables, and you have to eat the rainbow, eating as 40 grams of fiber at least a day. Most people are getting, in modern society, 5 grams of fiber a day. Grossly low amounts of fiber. Secondly is eating prebiotic foods, things like, yogurts that have active strains in them, also fermented foods. These are also food for good bacteria in your body. And thirdly is to avoid hitting your gut with insults. Insults are things that, like what they sound, they're an insult to your gut. They make your gut very unhappy. Those insults are ultra-processed food, seed oils, antibiotics, so don't take antibiotics unless you really need them, non-steroidal anti-inflammatory drugs. All of these act like nuclear bombs to your gut bacteria, destroying out entire populations and then having to have them reform over weeks, right? And so if you're one of those people that, are taking Advil constantly for pain, aches and pains, really try using something else like curcumin with pepper mixed in. That can really help reduce inflammation, reduce pain without the negative effects of something like Advil. So just finding those replacements, I think, is really, really important.
So what are some of the exciting things at NextHealth? Like, what are some of your favorite therapies? You mentioned a plasma exchange. It's something I want to try because I've never heard of it. And you described it to me where you get a vial of blood. Is it one vial?
No. So plasma exchange, you're getting a little bit more than that.
Getting more. I mean, and you're mixing it and then you're getting rid of the toxins. Yeah. It's just so amazing.
Right. So at NextHealth, just big picture, what we try to do is get everyone's lifestyle in order first. Then we can make sure they're not at risk of any major disease processes that we can affect with lifestyle. But we also put therapeutics in place as well. So we do full blood panels on people. We really direct therapy based on what we're seeing. And we really are a big fan of lifestyle changes. Now, once you get all that in order, we have some of this cool advanced longevity stuff that kind of, I believe, can move the needle. One of them is therapeutic plasma exchange. What therapeutic plasma exchange does is we hook you up to a machine. I'm going to have you try it one of these days for sure.
I'm going to do it.
We hook you up to a machine and we remove blood from one arm. We put it through a giant centrifuge and it separates your plasma from your blood cells. We then put the blood cells back in through another IV, but the plasma is completely removed and is replaced with albumin. What happens when you remove the plasma? We're removing 2 liters of plasma, actually.
Would I look thinner?
No, sorry. Won't help with that.
Okay.
Maybe over the long term, though, because what lives in your plasma is inflammatory cytokines, toxins live in your plasma, malformed proteins, viral vectors live in there. There's so much bad stuff that lives in your plasma.
Is there any good stuff?
There's also good stuff. There's growth factors. There's good stuff that also lives. Micronutrients live in your plasma. However, the bad stuff is what we're struggling to eliminate through our kidneys, through our livers, through our respiration, and our bodies can't keep up, right? And so when we remove 2 liters of plasma at a time, it acts like an oil change, like a reset for your biology, gives your organs and your systems a break for a little while. And so we've seen lots of improvements in reducing inflammation, reducing really high Lp(a) levels, reducing toxin levels, multiple different kinds of toxins, including microplastics, by using therapeutic plasma exchange. So it's about a 2 or 3 hour procedure. We do it, it's very comfortable. You don't really feel anything while you're sitting there doing this. And I think there's going to be a lot of great science coming out around how this works, why it works, and hopefully, it can get to a price point where people can work it into their routines as well.
How often would you have to get this done?
So no one really knows. There's been some great studies out of San Francisco by Dr. Kiprov doing it on a weekly basis for 6 weeks in a row to actually slow the rate of Alzheimer production, slow the rate of Alzheimer's and cognitive dysfunction. And then some people do it like once a month for 6 months. Me personally, and I'm experimenting with different ways of what the protocol would be. For me personally, I do it every 2 to 3 months. And I think it's really going to be highly dependent on your own biology. How much of a toxin burden do you have will dictate how much you have to do it. Right?
And you can test for that, right?
Yes, you can.
You can test. Like, how do you test for the toxic exposures that you have?
So we do what's called a total urine tox panel. So we test for it mostly in the urine, and we can test for hundreds of different toxins, molds and microplastics and BPA and lots of different things.
Wow. So NextHealth is like literally like, it sounds like my wonderland.
Thank
I could
you.
like live here. I love it so much. I think you're doing so fast. Like you're here in LA, but you've got one in New York, which is great, right in Manhattan, soon to be all over the world, really.
Yes, absolutely. And like you said, me being a physician, I went through my own health journey where I was very sick for a long time. I wanted to find out how to do medicine better. And I really feel like bringing things out into the wellness world that are previously locked up in the hospital world.
Yeah.
Plasma exchange has been around forever. It's been around for
Really?
decades. We've been using it in the hospital to treat autoimmune crisis, for example. Like those are therapies that can help. Hyperbaric oxygen, another therapy that's been locked up in hospitals to treat major things, but can also help your wellness. I wanted to have a place where people can get tests readily, not have to fight their doctor for it, get the most advanced testing, have these therapeutics available, have things like IV NR available, which is a better form of nicotinamide, adding NAD, better form of NAD. Like these things are not available in everyday medical care. NextHealth will make them more available, and we're expanding all over the nation to make that happen.
I cannot wait to see this. I cannot wait to support your journey. Thank you so much. We're going to link all of your socials and everything about you in the show notes below. But Dr. Darshan Shah, thank you so much for being part of the Neuro Experience.
Thank you so much for having me. It's been a pleasure.